All right, welcome back. This is our continuation of our review of our third BCBA practice exam, where we're going through the next set of questions and breaking them down together. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. If you're looking for our study materials, please check out bcbastudy.com. We offer 3 full practice exams, a taskless study guide, and a combo pack, which includes flashcards. It's our best deal. As usual, when you do pass your exam, please let us know so we can include you in our Sunday shout out. Work hard, study hard. Let's get to our questions. Your client is a 3-year-old girl with autism. Throughout the day, she will stick coins in her mouth. Whenever you tell her to stop, she smiles and continues to do it. Although she hasn't swallowed the coins, it is possible she could someday. What will be the best and quickest intervention for this behavior? Teaching opportunity here. As always, I tell you, make sure you understand what the question is asking. In this case, the question wants to know about the intervention for this behavior. Specifically, they want to know about the best and quickest intervention for this behavior. Remember, anything in the question stem matters. We need to take it seriously because it's important information to help us answer the question. So when they want the best and the quickest intervention for this behavior, this is the intervention we're looking for. So let's evaluate the behavior. We have a 3-year-old girl with autism. She sticks coins in her mouth. Whenever you tell her to stop, she smiles and continues to do it. Your hypothesis immediately should be thinking attention-based. Although she hasn't swallowed the coins, it is possible she could someday. Not a safety risk yet, but a potential for a safety risk. A crisis or an emergency could come about because this girl is putting coins in her mouth. So we are looking for the best and quickest intervention for this behavior. Well, the best intervention is going to address the function, which is attention, but the quickest is going to make sure she cannot put herself in any more harm by putting coins in her mouth. So we need to find the answer choice that reflects the best of both of those. A, put the behavior on extinction. Attention appears to be reinforcing the client putting coins in their mouth, and the client hasn't swallowed coins before. All right. Sure, extinction deals with the function of the behavior. We're not giving attention to the client. The problem is it's not quick, and it presents an opportunity where we aren't paying attention or we aren't giving attention when she does put coins in her mouth, putting her at risk for danger. Yes, she hasn't swallowed coins yet, but the question says she could someday. A is good when it comes to addressing the function of the behavior, but it's definitely not quick, and it definitely does not avoid the chance of danger. B, send your client to timeout every time they put coins in their mouth. All right. What is maintaining the behavior right now? Well, you telling the client to stop. If you tell your client to go to timeout every time they put coins in their mouth, you're just giving them more attention. All you're doing is continuing to feed into the function of the behavior. B is not a good choice. C, continue to tell your client how dangerous it is to put coins in their mouth. They need to learn safety skills. Okay, this is a lot of assumptions for C. Hopefully you're not drawn to this. One, it's a 3-year-old girl with autism. We don't know her level of receptive language to start with. However, continuing to tell her how dangerous it is to put coins in the mouth not only gives attention to the behavior, but it's not actually addressing the behavior through any sort of manipulation of consequences. All we're doing is telling her how dangerous it is to put coins in the mouth, and we're focusing on safety skills. It's not the best intervention, and it's certainly not the quickest. So it leaves us with D, hide all available coins and block your client from accessing coins. Through response blocking, we are going to avoid giving attention for putting coins in their mouth, because how can we give attention for that behavior if she isn't able to put coins in her mouth? And it's going to be the quickest way to prevent danger, right? If we don't have any access to coins, we can't even be put in a situation where she could get coins to put in her mouth. So the best and quickest intervention is going to be D, hide all available coins and block your client from accessing the coins. Which of the following would be considered an explanatory fiction? Okay, when we think of mentalisms, what do we think of? We think of explanatory fictions, we think of hypothetical constructs, and we think of circular reasoning. So hypothetical constructs and explanatory fictions, think about those two things being related. The hypothetical construct is the idea, right, or the concept, such as tired or frustrated. The explanatory fiction is when we use the hypothetical construct to explain away the behavior. So in this case, tired or frustrated would be our hypothetical construct, Glenn says Truman lashes out when he is tired or frustrated would be the explanatory fiction. We're explaining away the behavior using this idea of tired or frustration. And we know in applied behavior analysis as BCBAs, we are not going to explain away behavior by saying Truman, for instance, is frustrated. What would C be? C would be circular logic, circular reasoning. Truman lashes out due to his behavior disorder. His behavior disorder causes him to engage in problem behavior. As you can see, we are just going around in circles. Why does Truman lash out? He has a behavior disorder. His behavior disorder causes him to lash out. This kind of circular reasoning does nothing to help solve the problem. D, none of the above. Well, we already picked B. We said B is going to be our explanatory fiction because we're explaining away our behavior, saying he's tired or frustrated. Once again, tired or frustrated would be our hypothetical constructs. Temporal locus consists of what? Okay, remember we have what three umbrellas, so to speak, of measurement, where our measurements are derived from. We have temporal locus, we have temporal extent, and we have repeatability. Now you need to know these three, okay? Repeatability would be things like frequency and count. Temporal extent would be things like duration. Leaving temporal locus, what do we derive from temporal locus? Well, temporal locus is talking about a point in time. So does IRT, or is IRT derived from temporal locus? Yes, it is. Okay. So do we pick A and move on? No, we don't. What is our rule? We read every answer choice. Read all your answer choices. So what about IRT and latency? Yes, temporal locus consists of both inter-response time and latency. What about C, IRT, latency, and duration? Well, duration is actually part of what? That's part of temporal extent, not temporal locus. So we can eliminate C, we can eliminate D, leaving us just with B. Temporal locus consists of IRT and latency. Every week, you provide parent training to a difficult parent. No matter what you try, the parent will not implement your interventions, and the client is failing to make progress. Are you allowed to discontinue services? So this is actually an ethical question. This is from the ethical code. So what is the question asking? The question is asking you if you think you can stop or discontinue services. Now, in our code, there are several reasons listed why we can discontinue services. Hopefully you have my study guide, and if you do, you need to go look into what those reasons are. That's very important. You know the different ways we can stop services or why we can discontinue services. We have that authority as behavior analyst. In this case, you're providing parent training to a difficult parent, but no matter what you try, the parent will not implement your interventions and the client is failing to make progress. So the issue is what? Well, mainly the issue is the parent is not following through. Is that enough cause for you to discontinue services? A, no, you must continue doing your best for the client and work around the parent. That is not the case. If the stakeholders are not compliant and it is hampering your ability and the client's ability to make progress, you are in your right to discontinue services. What about B? Yes, but only with permission from the parent. You do not need permission in this case to discontinue services. They are not complying with the behavior plan. They're impeding the client's ability to make progress. You are in your right to discontinue services. So should you C, yes, terminate services immediately, or should you D, yes, but develop a transition plan? Well, just because the parent is not following through doesn't mean we are going to penalize the client. So we can't just terminate and abandon. We don't abandon clients. You are allowed to discontinue services, but you have to first develop a transition plan. Meaning, can you find a referral? Can you find another person to take on this case? How are you going to help out the client, even though the parent is not willing to work with you? Before you discontinue, even though you're allowed to, you must develop a transition plan. Remember, we don't abandon clients. A behavior analyst has been supervising your case for 6 months, but has seen little to no progress. The analyst is extremely frustrated and has doubts that she can help the client given the analyst's current skill set. How should the analyst handle the situation? All right, another ethical situation. We are working within our competencies. Remember, as behavior analysts, we only take clients who we are trained to work with. Meaning, if my client has an eating disorder and I'm not trained in eating disorders, I do not work on that client's eating disorder. In this case, they want to know how would the analyst handle the situation. This analyst has seen little to no progress in 6 months. The analyst is extremely frustrated and has doubts she can handle the client given the current skill set. That is the key there. The analyst's current skill set is not adequate to handle the client. Now, maybe when the analyst took the client on, it wasn't unethical. Maybe the analyst believed they could handle the client. 6 months later, the analyst is looking in the mirror, being mature about this situation and saying, I'm not capable. What do they do? A, continue with the client. You should not give up on a client. Well, if we think about our previous question, just because we are quitting or discontinuing services doesn't mean we're giving up. We need to have some sort of transition plan. But in this case, we're clearly not making progress. The analyst is not capable of handling this client. Something needs to be done. B, terminate services with the client as soon as possible in order to not waste any more of the client's time. Again, what's our rule? We don't abandon, so we don't just leave them the next day. So C, create a transition plan for the client and refer the client to another provider. Yes, okay, you're not equipped to handle this client. Now, could this analyst get training? Sure. But if we look at D, attend a year-long training course that targets the client's specific needs. If it's going to take a year to bring this analyst up to speed, are we going to really waste another 12 months waiting and hoping? No, we can't do that to this client. Time is of essence. It is invaluable. It's too long. If the analyst wants to receive supervision on this case, that's a different story. But if they're going to first receive this year-long training course, it's too long. The best answer here, and we're always looking for the best answer, is to create a transition plan for the client because we can no longer adequately serve them and refer the client to another provider. Although your session lasts 3 hours, we really only need about 20 minutes of data to make a determination on this particular client. What type of measurement could you use? So be careful here. This is an easy question, but it's one that trips people up because they overthink it, okay? Because we all think so hard about continuous measurement, discontinuous measurement, when to use it, when not to use it. Don't overthink this, okay? Your session lasts 3 hours. We only need 20 minutes of data to make a determination. What type of measurement could you use? Could you use continuous measurement? Sure, right? Continuous measurement, continuously measure for 20 minutes, right? Why not use duration or rate or frequency or any of our continuous measurement procedures? It's not an issue. What about discontinuous measurement? Well, absolutely. Discontinuous measurement is using this time sample as interval anyway. So if we only need 20 minutes of data, maybe we'll use a whole interval measurement system or a partial interval measurement system. Nothing wrong with using discontinuous measurement. Now, if this says we need to take data on all 3 hours, we're probably going to use a continuous measurement, right? Discontinuous measurement isn't really built to do the entire time frame. It's built to take a sample of time. But in this case, both continuous measurement and discontinuous measurement, they're fine. Another good example of why we read all of our answer choices. And then C, permanent product. Well, permanent product isn't really going to allow us to take 20 minutes of data because permanent product is just measuring the product, right? We don't need 20 minutes of the product. We just need to see the product and measure it. However, we can use continuous. We can use discontinuous. So what type of measurement could you use? Both A and B. Samantha wants to buy a booth at the upcoming ABA conference to advertise her company that uses behavior analysis to teach kids how to draw. If Samantha wanted some reviews for her services, how should she go about collecting those reviews? Well, this has gotten more focus as social media and things like that have started to take in more precedent in the ABA field in terms of marketing. The board is serious about testimonials and the like, okay? They want us to represent ABA in a good light, okay? And we want to not put clients in bad situations. We don't want to put ourselves in bad situations. So in this case, we're talking about reviews. And the BCB ethical code is very clear about reviews, okay? So what can Samantha do? She wants some reviews for her services. How can she go about doing that? A, Samantha should ask her current clients for testimonials. Can Samantha ask current clients for testimonials? She cannot, okay? We cannot use current client testimonials in our advertising. B, Samantha should ask current and former clients for testimonials, but disclose if she solicited the testimonials or not. Again, we do not ask current clients or testimonials, so we have to discard A and B. C, solicit testimonials from former clients, but she does not need to disclose if the testimonials are solicited. Well, does Samantha need to say how the testimonials were obtained? Yes. If Samantha is the one who solicited the testimonials and is using that review for her own gain, she has to say where they're from. If Samantha receives a review on Google Ad or Google or Yelp or somewhere else and has no control over the reviews, that's different. If Samantha has full control over that review, she has to say where they're from. So D, solicit testimonials from former clients, but disclose if testimonials were solicited. That is the best way for Samantha to go about collecting these reviews. Whenever Dennis and Dee go out to play, their dad, Frank, tells them to avoid the bridge because they have to pay the troll toll to cross the bridge. This is an example of what? Okay, what is the question asking about? Well, it's kind of vague, right? And when the question is this vague, then we have to attack it a little differently. But we still want to understand the question stem. So we know Dennis and Dee go out to play. Their dad, Frank, tells them to avoid the bridge because they have to pay the troll toll to cross the bridge. So it sounds like he's setting up some sort of contingency, but it's a verbal contingency. So they're not actually, their behavior isn't actually being shaped by paying the toll. They're just being told that if they go to the bridge, they'll have to pay the troll toll, so they need to avoid it. So is this contingency shaped behavior? Well, it's not. Contingency shaped behavior is when behavior is actually altered due to the consequence or the contingency. If this is a verbal statement, what do we call that? Do we call it a high P request sequence? Well, Frank isn't delivering a bunch of high probability requests in a row for a low probability request. He is giving them a rule. Okay, he is offering up a rule-governed behavior. This is a verbal statement establishing a contingency. And it's not speaker behavior, okay, because we're looking at Dennis and Dee listening to Frank tell them to avoid the bridge. This is Frank's rule. This is his verbal contingency. Avoid the bridge because you have to pay the troll toll. When his class returned from summer break, Mr. Johnson gave a pop quiz on the first day of class and said, all right, let's see what you forgot over the summer. Mr. Johnson is testing for what? So there's one key here, okay, because we're looking at Mr. Johnson. Now, we want the best answer, okay? So he gave a pop quiz on the first day of class and said, all right, let's see what you forgot over the summer. If we're testing for skills that were previously learned to see if they are still there, what are we testing for? Are we testing for generality? Now, maintenance is technically in the umbrella of generality, okay? But we're only allowed to pick one answer, so we need the best one. So we're not looking for generality here necessarily, okay? If he's asking to see what they forgot specifically, Mr. Johnson is really testing for maintenance. Mr. Johnson knows they were taught these skills. Teaching stopped, and once teaching stops and we test that skill, we're testing for maintenance. Mr. Johnson isn't probing because that probing is for typically unknown skills and unknown repertoires. Mr. Johnson assumes they have this repertoire already, and he wants to test for maintenance of these skills. And then magnitude, he's not testing intensity or anything of the like for their behavior. He's simply testing, are these skills still there after teaching had stopped? And then finally, which of the following interventions manipulates motivating operations? So what is a motivating operation? A motivating operation increases or decreases the value of a consequence. They can be evocative, they can be abative, they can be establishing, they can be abolishing. And now, which of the following interventions manipulates these MOs? Remember, an MO is what? It's an antecedent. So positive and negative reinforcement are consequences. These aren't going to manipulate the MOs, okay? What about non-contingent reinforcement? Well, non-contingent reinforcement is one of the most popular and best ways to manipulate motivating operations, especially for something like attention-based behavior. With non-contingent reinforcement, we would deliver attention on some sort of schedule in order to hopefully decrease the value of that attention, thus manipulating the MO. The prompt comes after the MO, so it couldn't manipulate the actual MO. So our best answer is going to be non-contingent reinforcement Which of the following interventions manipulates MOs? It's going to be C, NCR, non-contingent reinforcement. Okay, thanks for watching. We'll be back next week with another, or part 9, I should say, of our exam review. Remember to check out bcbastudy.com for all of our study materials. Questions, comments, let me know. As usual, work hard, study hard. See you soon.